So we got a report that our client Larry NGO is having difficulty breathing, so we're going to go ahead and provide him with some suctioning as well as some trach care. So before I go in, I've looked at what needs to be done, I've collected my materials, and then I'm going to go ahead and gel into the room, and I'll knock. Hi Larry, my name is Carmiel, I'm your nurse, and I was told that you're having some trouble breathing right now. So we're going to go ahead and take a listen to your lungs, as well as probably do some suctioning to clear out some of those secretions, all right? Can I have you state your name and date of birth, please? And I'm checking that. Awesome, looks good. Generally, just do you have any allergies? We're not going to be using anything that should cause irritation, but no drug allergies, always a good thing. So I'm going to go ahead and raise the bed so that I can protect my back, and then I'm going to go ahead and get started by taking a listen to your lungs, as well as assessing your oxygen. How's the day been aside from this difficulty breathing? I'm also going to provide privacy really quickly. Alright, so aside from this difficulty breathing, has everything been going alright for you today? Awesome, man, I'm glad to hear. Are we doing okay here at Bellevue College Hospital for you? Cool. Alright, well if you have any concerns, let us know. We'd be happy to try to do our best to make you comfortable and happy while you're here staying with us. So I'm going to go ahead and place this pulse oximeter on your finger. We'll go ahead and get a read at what you're at. And then I'm going to go ahead and take a listen to your lungs, just so we get a baseline and kind of be able to evaluate how well the suctioning was able to clear out your secretions. Alrighty. Ooh, that's not looking too hot, my friend. We're at 89. So do you feel like you're lightheaded at all or having difficulty right now? Okay. Yeah, it seems like it, but... Alright. And one thing we're going to do is we're going to hyper-oxygenate you for this procedure because you might have difficulty breathing while we're going through it. So I'm going to go ahead and just get that started right now, and we're going to go ahead and get some oxygen to you, okay? And then I'm going to have you take a couple deep breaths for me when I place my stethoscope on your chest, okay? Alright, nice deep breath in through your nose and out through your mouth. Good. In through the nose, out through the mouth. Good. All right. And one more big one for me. Perfect. Alright, so yeah, we can definitely hear stuff. There's some gunk in there, so why don't we go ahead and get that out and hopefully make breathing a bit easier for you. We're getting your oxygen level up, so that's good. And I'm going to go ahead and get myself ready and set for the care we'll provide for you, okay? So I'm going to go ahead and place this towel right below your trachea, just so we can keep it nice and clean. Good. I'm also going to remove the pillow from behind your head because I'm going to need access to that area. So if I could have you just kind of rest your head back. Perfect. Are you doing okay there? It'll just be a couple minutes. All good? Glad to hear it. Alrighty. So, I'm going to go ahead and open this up. And this is all sterile. So, I got sterile gloves in my pocket. Yes. We'll be able to do this. Do some hand hygiene. And then I'll reuse that. I'll loosen this, pour some in here. And I'm going to go ahead and unfold this, holding everything back. Do my best not to cross my sterile area. Pinch. underneath. And I'm going to go ahead and clear this right over here because I'm going to need this basin as well. And I'm going to go ahead and pour right in there as well. So we have 2 little areas we'll use. Our stale water, and I'm going to go ahead and scoop right under here. And try to get this glove on. So what brought you in, Larry? Okay. Is that something you were expecting to happen? Oh, okay. Well, that's always a good thing.
It didn't take you by surprise at all.
Alrighty. Well, I'm almost ready to get started. I'm trying to get my gloves up a tiny bit higher. Glove to glove. And there we are. Alrighty, Larry. So we're going to go ahead and start off with suctioning. That's why we did hyperoxygenation. This is going to be my sterile hand. This is going to be my non-sterile hand. And for suctioning, we're going to go ahead and grab our suction tube, which is right under this material here. Alrighty. So I'm going to go ahead and make sure our suction works. So I'll turn it on to regular. And I'll crank it up to, let's go 95. And then my tubing is right here. Seems like it works. We're going to go ahead and place this in here. This is all sterile. We're going to keep that away from here. And then we're going to go test suctioning again. Sounds like it works. Suction up some water. And we're all ready to go. So what's going to happen is I'm going to go ahead and place this tube down to the carina, which is right where your trachea breaks off into 2 different parts. And when we hit that point, you're likely going to cough. When we get there, I'm going to go ahead and pull up a tiny bit, just about an inch off, and I'm going to go ahead and start to do some intermittent suctioning as I make my way back up. We're going to hope that clears some of the secretions, and then we'll probably do 1 or 2, we'll do at least 2 passes, all right? So we're going to go ahead and move this tube right here, removing our oxygen. And then I'm going to go ahead and pass this right down through until I feel a sticking point. Doing okay? And if you have any trouble, just raise your hand or say something if we need to stop, okay? Alright, so that means we hit the carina, so I'm going to go and pull up a tiny bit. And we're just going to do our intermittent suctioning on our way up. Right on. Alright, we got some gunk coming through, Larry. Good stuff. Alright, I'm going to go ahead and give you the oxygen again. We'll go ahead and wait 30 seconds. Yeah, we went down a tiny bit, so let's go ahead and get those sats back up. And then we're going to go ahead and clean off the tube. Alright, we got a nice clean tube, so let's go ahead and get some more stuff in here so we can get that stuff out of you. So, 30 seconds passes. We're going to go ahead and do our second suctioning. I'm just going to feed this right through. Alright, Larry, we hit that spot, didn't we? So we're going to go ahead and suction on our way up. And yeah, we can see all of that mucus, all that stuff should not be in there. I'm glad we're able to get it out. Alright, let's go ahead and get you back on some oxygen. And then we're going to go ahead and... You think, or do you feel as though you're going to be breathing better? We did get a lot out. Good. All right, so we'll go ahead and call it good with 2 suctioning. If we need to do more later, that's something we can do, but hopefully we got enough so you can breathe clearly, okay? So now we're going to go ahead and move on to your trach care. So we can toss this, turn off suction, and then let's see how your sats are doing without oxygen. So I'm going to go ahead and turn this off, keep the monitor on, and we'll remove this. And then I'm going to go ahead and remove your trach with my clean hand. And we'll go ahead and place that in our solution. And then I'm going to go ahead and remove the pipe cleaner with my clean hand as well. This is my sterile hand. I'll use that to assist. And And then with my sterile hand, I'll go ahead and grab the, do you want to clean before? No, we'll clean your trach first. So we're gonna go ahead and grab the trach, and we'll get inside of there, trying to get all that gunk out. Nice deep clean, both sides. Well, why don't we rinse that stuff through? Good. Other side, make sure we get everything in there, all the way. Rinse through, get the outside. Making sure I only touch it with my sterile hand. Alrighty, you can toss this. And with my sterile hand, I will go ahead and put this back in. You're doing okay there, Larry? Yep, it's all good. Awesome. And we're clicked into place. Alright, Larry. So we're gonna go ahead and continue just cleaning everything up. So now everything is clean, no longer needs to be sterile. So I'm gonna go ahead and remove your dressing, and we're just gonna clean around everything, and we'll replace your dressing with something brand new because it is looking a bit gunky there as well. So I'm gonna go ahead and pull this off, and if you feel as though anything is moving or anything's pulling too tight, let me know. I don't want you to be in any pain.
So we did 3 ml.
So we're just gonna hold that there. Pull this through. We'll toss this, but we'll be reusing this. Alright, Larry, I'm gonna go ahead and grab this. We're gonna go ahead and start with the outside, getting all that gunk out and around. Good. Get it nice and clean. And toss that. And the second one right in here. And then we're gonna go ahead and get right underneath there, okay, Larry? Good. Don't feel anything moving down there. Nice. All right. Get some scrubbing. And how's your breathing feeling, Larry? You feeling better right now? Right on. All right. Well, your oxygen stats look better, so I'm glad to see that, mate. All righty. That's all cleaned up. Let's get you dressed. So we got our little butterfly gauze right here, and I'm gonna go ahead and just put this right underneath. Alright, that's nice and secure. And then we're gonna go ahead and get a tie around there so that thing does not move, because we don't want it to move. Let's go and start with this side, sorry there. I'm just gonna thread this through really quickly.
And there's no blood.
So, yeah, maybe top down was the way to go. No, we got it through there. All right. I'm gonna come bottoms up so I can see where I'm going. Sorry, Larry, give me a second. All right, we'll go ahead and go through this side and then we'll come around the other way, okay?
No, don't. Did I make any mistake other than what happened?
You did catch yourself. Did you see CDC and
Alrighty. So we're gonna get this nice and flat, so minimal abrasions. And I'm gonna go ahead and get this secured tightly, but not too tight, hopefully. So let me know how you're feeling as we get it down and around your neck, okay?
And then, I don't know. Everybody's fine. Take my afternoon off. I'm like, well, I work at 7.
Alrighty. So now I'm gonna thread this through and we'll go ahead and tie it down.
Yeah, evergreen is one. They may have like the next and then
Trying to keep that from moving. There we go. Alright, does that feel too tight there? That's alright? Awesome. Alright, here's the first knot. Still doing okay? Good. Pardon my fingers, Larry. Just want to make sure this is nice and secured. Oh. Alright. Is that feeling okay, Larry? Perfect. Glad to hear. Alrighty. So we're almost done here, so I'm gonna go ahead and just move our equipment back. Still feel like you're breathing okay? Alright, I'm gonna go ahead and take a listen to your lungs really quickly to see how it's going, okay? I'm just gonna change my gloves just because we're done with the procedure. We'll get some other gloves on. I'll get you your pillow back in just a second. And then you can go ahead and put this in dirty linens. Alright, Larry, go ahead and pop your head up. Is that comfortable there? Perfect. Alright, let me go ahead and take a listen to your lungs really quickly. Let's see if we did a good enough job clearing everything out. Nice deep breath in. Good, sounding good. And one more deep breath in. Perfect. Awesome, Larry. Everything sounded a lot clearer, and you're breathing better as well. I'm going to take this off your finger. It's looking good. And then I'll clean up my station, remove my gloves, perform hand hygiene. And then I will go document the care that I've given, as well as make sure that Larry, we need to make sure you have your call light. If there's anything else you need, just let us know, and we'll be here as quickly as possible to help you, okay? I'm also going to lower the bed really quickly. And then I will also remove privacy. And we're good.